Hi, I'm Dr. Jeff Shells with Advanced Chiropractic, and today I wanted to go over our chiropractic adjusting tables and the different aspects of the table and how it helps our patients. So these are our tables. We've had these for about 6 years now, and we just love them. And the reason we love these tables is because they can do so many different things. You know, whenever a patient comes in, the very first thing we do, we take their history, we find out about some problems they've had. We do an exam and we get x-rays of their spine so we know exactly what the problem is and then how we would be able to help them. And of course, the programs that we recommend at our office are designed to get them out of pain and fix their problems as much as possible. And the foundation of all the chiropractic care truly are the adjustments. Of course, we have other things in the office rehab and we send them home with things to do like exercises and traction and those kind of things. But the heart of what we do here with the thousands of patients we've seen in the past and all the people we see nowadays are the adjustments. And this is where the magic happens. So after we do all the workup and we know what we're doing with the patient, the adjustments take place on these tables here. And so there are a number of different ways we can adjust. So for instance, there are some patients that we use this technique called a drop section. And with the drop section, the table comes up just about 1.5 inches, and if we have the patient laying down like this, the lower part of their spine is here, and we're going to get right on the spine on the area that's not lined up, and we press in, and as we do that, the table drops down. And it's kind of loud, but it usually doesn't hurt, it usually feels good. But the goal with that drop table is to move that vertebra, and it really uses that kind of jerking motion to really move that vertebra quite a bit. So this technique really does get the spine to move a significant amount, hopefully getting the pressure off the nerve and getting the patient feeling better. We can use it in the low back, we can use it in the mid back. You can even use it in the neck on some patients. We don't do a whole lot with the neck, but we do use that technique quite a bit with the low back, all right? Now, another way we can adjust is with this variable adjuster. And what this tool does is it has this tip on the end, and we can put it right on the spine and we can put an impulse. And the nice thing about the variable adjuster is the harder you go, the more it pushes. So in the low back, you might be able to go a little bit harder on some people, and you can angle it and move it in certain directions based on the patient's alignment that we found on the x-rays, and really over time move the vertebra towards a more normal alignment, helping them get out of pain as well. And this instrument we can use really anywhere in the spine. Of the 3 different primary techniques that we do use, this is the lighter force one. So this technique we really can use on anybody. Certainly if a person was somewhat in an advanced age state and their spine had osteoporosis or something along those lines, you might use this technique instead of the other techniques because it does is a lighter force, right? But really you can use that technique with anybody. And then the last technique, and the one we use primarily on most people, is simply adjusting by hand. So the patient's laying down, we use our hands based on their x-rays again to go in and put an adjustment in there. This is the technique where you'll hear popping or clicking. The other techniques you don't really hear as much popping and clicking. And when we do adjust like that, you know, that sounds not a bone hitting a bone, but rather a gas bubble in the back of the spine. Kind of like when you open a Coke, it'll pop, you'll see the bubbles. The difference is with the Coke, the gas escapes. With your spine, it just opens up but settles back down. And of course, we can adjust the whole spine with that hands-on technique, or some people will use a combination of some hands-on, some drop, some hands-on, some instrument. It really just depends on what the patient's tolerance is and what we found on the x-rays. So we love our tables. We think they're just fantastic, and they really have allowed us to help thousands of patients over the years. And if you are having issues and you'd like to find out if our adjusting tables and the doctors can help you, just give us a call at 254-778-2225. Have a great day.